A groundbreaking combination of two cholesterol-lowering drugs has the potential to save hundreds of thousands of lives each year by preventing fatal heart attacks, strokes, and other cardiovascular diseases. The largest study of its kind, published in the Mayo Clinic Proceedings, analyzed data from over 108,000 high-risk patients and found that using both a statin and ezetimibe from the outset was significantly more effective than statins alone. The results are compelling. A 19% reduction in overall mortality, a 16% decrease in deaths from cardiovascular causes, and a 20% drop in major cardiovascular events such as heart attacks and strokes. These findings suggest that medical guidelines worldwide should change to prioritize this dual-drug therapy for those at the highest risk. The mechanism behind this success lies in the way these drugs work together. Statins, long considered the gold standard for cholesterol management, reduce cholesterol production in the liver. Ezetimibe complements this by limiting cholesterol absorption in the gut. While statins alone have saved millions of lives, the study's authors argue that many patients still face significant cardiovascular risks due to persistently high LDL cholesterol levels. The new research demonstrates that starting both drugs simultaneously leads to much better cholesterol control, significantly increasing the likelihood of reaching the ideal LDL-C target of under 70 milligrams per deciliter. The stakes could not be higher. Cardiovascular disease remains the leading cause of death worldwide, responsible for 18 million fatalities each year. High LDL cholesterol alone accounted for 4.5 million deaths in 2020, with the highest burden in Eastern Europe and Central Asia. The study's lead author, Professor Maciej Bonak, emphasized that making this combination therapy standard practice could prevent more than 330,000 deaths annually among patients who have already suffered a heart attack, including nearly 50,000 in the United States alone. Historically, doctors have been hesitant to prescribe combination therapy right away, opting instead to start with statins and add ezetimibe only if cholesterol levels remain high after several months. However, the study's findings suggest this delay could cost lives. For patients at very high risk, early intervention with both drugs appears to be the best course of action. Professor Peter Toth, a co-author of the study, called for an immediate shift in treatment guidelines, arguing that this dual approach should be the new gold standard. By lowering cholesterol more aggressively and earlier, patients could not only avoid life-threatening events but also reduce their risk of developing long-term complications such as heart failure and recurrent strokes. Beyond its life-saving potential, widespread adoption of combination therapy could also ease the financial burden on healthcare systems. Treating heart attacks and strokes is costly, requiring hospitalizations, surgeries, and long-term medications. Preventing these events in the first place would not only improve patient outcomes but also reduce overall medical expenses. Statins and ezetimibe are already available and widely used, meaning implementation of this approach does not require new drug development, just a change in how doctors prescribe these medications. Despite the overwhelming evidence in favor of combination therapy, barriers remain. Many patients do not adhere to cholesterol-lowering treatments due to concerns about side effects, a reluctance to take multiple medications, or a lack of awareness about the dangers of high cholesterol. Public health campaigns and physician education will be essential to ensuring that those who need this treatment receive it. Additionally, policymakers must work to make these medications more accessible, particularly in regions where cardiovascular disease rates are highest. The message from researchers is clear. For patients at the highest risk of heart disease, waiting to escalate treatment is not an option. The earlier LDL cholesterol is aggressively managed, the better the outcomes. This study reinforces the importance of the principle, the lower the better for longer, but adds another crucial lesson: the earlier, the better. For those at risk, adopting this approach could mean the difference between life and death.